Hi, Mrs. Smith. I'm Jackie. I'm going to be your nurse for this evening. The doctor has ordered for you to have an indwelling Foley catheter. Please state your name and date of birth so I can compare those to my records. Okay, thank you. Okay, so what we're going to do is go ahead and get started. I'm going to give you a bath blanket. We're going to place that on the top half, and then I'm going to remove the your heavier blanket, and I have to clean your peri area, and then we'll begin with the catheter insertion process. And when we get closer to that, I will explain further. So for now, do you have any questions or concerns? Okay, no? All right. Now, do you have any allergies to latex or iodine before we get started? You don't? Okay. All right then. So let me go ahead and clean my hands. Okay. I'm cleaning my hands with some alcohol sanitizer. All right, so let's get started with your bath blanket. Okay, let me get my gloves. All right, so I'm just going to drape this on top of you here. Okay, are you comfortable? Okay, good. All right, now I'm going to pull your blanket down. Okay, and let's go ahead and get cleaned. These are peri wipes here, so they're warm. Now, if it's too warm or too cool, please let me know. So let's go ahead and flex your knees up, okay? And gently allow your legs to separate. All right? All right, so here we go. Okay, we got one wipe. We're cleaning inside the thigh. Let's throw that away. Now let's get another wipe. Let's clean the other inside of the thigh. Throw it away. Now let's see here. Let's go down the center. Okay. Let's throw that away. And once again, going all the way down. All right. So we're done with that. Now what we're going to do is we're going to put this blue pad underneath of you. This is going to absorb any fluid. Okay, so let's lift your hips. Are you able to lift them? Oh, you can. Thank you. Thank you. I appreciate your help. All right. So now I'm going to take off my gloves and clean my hands. Okay. Excuse me. Okay, so let's go ahead and open our kit. We're not going to touch anything but the edges here. Okay, and now I'm going to put on my sterile gloves. Dr. White, my kit did not come with sterile gloves. I couldn't find any gloves in my house other than what I have here, which are cleaning gloves. So I will put my non-dominant hand on first. And here we go. My thumb isn't going to touch this. Okay, now I'll roll the cuffs up. All right, ma'am. So let's go ahead. We have a sterile I'm going to put underneath here, your sheet. So let's lift your hips up again. Okay, thank you. Okay, our hospital policy, we don't have to use the fenestrated drape, so I'm going to be discarding that. Okay. All right, now let's move our kit closer here. Okay, So I'm going to go ahead and attach the syringe to the port here. Okay. And we're going to pull the catheter out here. Okay. Let's throw that away. And we're going to lubricate the tip 2 inches. So, lubricating the tip. Okay, now we'll place it back here. All right, Miss Smith. Now let's go ahead and clean your labia and down your meatus. Okay, we're gonna use the iodine swabs. Excuse me. All right, so I'm gonna spread your labia apart. Okay. All right, now we're gonna go down your left side, swab down, discard. Now let's do the right side. Swab down, discard. Now let's go down to the center. Swab down, discard. Okay, so now I'm going to insert the 2 inches of the lubricating catheter into your meatus, okay? Now, please let me know if you have any discomfort, if you're experiencing any discomfort, okay? All right, in we go. Okay, 2 inches. Okay, I see urine, so we're gonna go in a little further. Okay, just about 1 inch or 2. All right, now I'm going to hold that and stabilize it. I'm going to insert fluid into the balloon. Okay, it's just 10 cc's. Okay, now let's tug. All right, that's in there good. Okay, I'm gonna discard that. All right, so let's go ahead and secure this to your left leg. All right, we're securing it. We're making sure that it's not too tight and it allows for movement. So now I'm going to go ahead and secure the drain bag down here, assuring that there are no kinks. Your tube. Okay. That, and that's attached down there to your bed. Okay. All right, so let's let me take this away here. I'm gonna throw that away. Let me take off my gloves. They're stuck to my hands. Sorry. Okay, we'll throw those away. And now let's sanitize my hands. I'm gonna get new gloves. Alright, so let's take these pads away. Okay. Alright, we'll throw those away. Okay. All our material is thrown away. Okay, ma'am. So what we're gonna do now, let's see. Let's pull your blanket up, and we'll remove your bath blanket. Okay. So now that you're all covered up and back in a comfortable position, I'm going to obtain a urine specimen. Okay, and I want to send that to the lab. All right, so I'm cleaning my hands. Putting on clean gloves. Now the rubric didn't say that we can use the Foley collection bag since it is a new one. Okay. All right, so let's do that. Awesome. Nice clear yellow urine. Okay, so we will send this to the lab. All right. Any questions, Miss Smith? Are you feeling okay? All right, let's sit you back in the correct position. I'll lift your head of bed and lower your bed back down to a safe level. Okay. All right, are you comfortable? Okay, good. All right, well, I'm going to go ahead and run this specimen down to the lab, and if you have any questions or concerns, please give me a call or ring your call bell, and I'll be here to help you, okay? Have a good evening.